Right, up next, Choi Min-jung is here with more on the COVID-19 situation here in the country and elsewhere across the world. Min-jung, welcome back.
Thank you for having me, Sunny.
Right, so I hear the special voting time slot for COVID-19 patients went quite well Wednesday evening, that would be.
That's right, Sunny. Voting for COVID-19 patients appeared to be much smooth, unlike the confusion that has been going on during early voting last weekend. People with COVID-19 cast their ballots starting at 6 p.m. after regular voting hours to minimize any risk of transmission. In a few regions, though, some people did not receive a test notification with information on the voting time, which led to some confusion. Health experts say that although some infections may occur from polling stations, an explosive surge as a direct result of the election isn't very likely. Others have also raised concerns over a possible spread of the virus at schools, where a number of polling stations were located. But health authorities have assured that there is a low risk of infection as these venues were all thoroughly disinfected and ventilated after the voting ended. The National Election Commission estimated that around 618,000 voters had voted after 6 p.m. And this being said, there were a total of 1.2 million people recovering from COVID-19 at home on Election Day. And as of Thursday, that figure is now close to 1.3 million.
Right, I see. Min-jung, meanwhile, the head of the global health body has called for continued caution, of course, against COVID-19. Tell us about that.
Right. The WHO Director General said during a briefing on Wednesday that the pandemic is far from over, even while global cases and deaths are declining and many countries are lifting restrictions. According to the agency's latest report, global COVID-19 cases fell around 5% in the previous week, with deaths also dropping by 8% over the past 2 weeks. However, the WHO chief cautioned that infections and deaths are surging in the Asia-Pacific region. The report showed that the Western Pacific saw a 46% increase in COVID-19 cases last week. The head of the global health body also said he was concerned that many countries have drastically reduced testing, saying this makes it difficult for experts to track the spread of the virus.
Right, and before I come back to you, Min-jung, I'm going to include Soa in our talk right now. So I understand the WHO has also separately voiced concerns about the violence over in Ukraine and its potential impact on the pandemic there. Tell us about that.
Right, Sunny. The WHO addressed a number of health issues in Ukraine, Russian attacks on medical facilities as well as healthcare workers. And yes, all of that is also affecting the COVID-19 situation there. So the health body says the coronavirus and other infectious diseases are more likely to amplify and spread under such poor conditions. Mike Ryan, a senior WHO official, stressed that conflict and infectious diseases are closely intertwined and that the health situation in Ukraine won't improve unless there is a ceasefire. With that, he in particular noted health risks among the growing number of Ukrainian refugees.
You put that many people in desperation on the move, women and children packed together, people in basements, people stressed, people not eating, not sleeping. These are the conditions in which immune systems are weak, people's defenses are low, and infectious diseases can rip through populations like this.
Right, unfortunately, of course. Min-jung, now, as you mentioned earlier, the WHO appears particularly concerned about the outbreak here in the Asia-Pacific region, right?
Right. China is witnessing its highest ever number of daily infections in 2 years, with cases remaining above 500 for 3 straight days. The country had been seeing under 100 cases, but figures began to increase around early March with the rampant spread of Omicron. Jilin province in northeast China was one of the regions hardest hit by Omicron, with a record of around 160 symptomatic cases newly reported on Wednesday. The city of Jilin has decided to close businesses for a week, with exceptions for those providing essential services. People are also not allowed to leave their homes unless it's absolutely necessary until Sunday. And meanwhile, the Omicron outbreak is also spiraling out of control over in Hong Kong. They are currently witnessing a spike in the number of fatalities, with over 2,600 deaths reported since the fifth wave swept across the country at the end of December. The majority of the victims have been the elderly, and around 90% were not vaccinated. And with this, the government has decided to postpone its mass testing plan, explaining that reducing the number of deaths is currently its #1 priority. And daily cases in Japan are also on the uptrend, with cases hovering around 60,000. And they have been reporting more than 200 daily deaths for 2 days in a row, although it's a drop from the country's peak of some 320 deaths around 2 weeks ago.
I see. All right, Min-jung, as always, thank you very much for the coverage. I'll see you on Friday.
Thank you.